Hi, are you dealing with knee swelling and pain? If so, you may have increased inflammation in through that knee joint. A common way to help with knee swelling as well as pain is to perform an acronym that we talk about, and this is called R.I.C.E. The R in R.I.C.E. stands for rest. It could be that you've overdone it, that you've used the knee joint too much, and the structures have then become weak. And in response to that, the tissues need some healing, and that's when inflammation will come to the area. So the rest will help to reduce some of the stress on the joint and tissues in that area to help reduce the swelling. The second portion of the R.I.C.E. acronym is I. And this is for ice. Ice is a great natural anti-inflammatory. Ice will help to reduce the swelling in the area by vasoconstricting or reducing the size of the vasculature in the area to decrease the amount of inflammation coming to that spot. Icing will help also to numb the area for pain. So two main things, reducing swelling as well as reducing pain. The third letter of the acronym in R.I.C.E. is C for compression. To reduce the swelling around a knee joint, you'll want to get a compressive sleeve or a stocking, and this will restrict the swelling in the area by reducing the amount of blood flow there. So it'll help to reduce the swelling over the course of the day. You could do a compression with just plain stocking. You could do a compression as well with a wrap around the knee joint to reduce that swelling there. It'll also promote some compression and stability in the knee joint as well if you have a weak structure there that may be giving way, contributing to some of that swelling in the area. You could also compress with ice as well for 10 minutes or so you can get both done at the same time. You'll promote that icing component as well as that compression component. The fourth acronym of the R.I.C.E. acronym is E, and E stands for elevation. Now, if we can elevate the foot above our heart, we can promote some of that blood flow in the knee joint and the swelling to make its way back up and reduce the amount of swelling in that area. For example, a great thing to do, and I'll just demonstrate that here, is if we take a pillow. You may need two. Some people don't need as much elevation, other people do. It depends on the level of swelling that you have. But this is just an example of a way to set yourselves up. So imagine that you're laying in bed. Whichever knee you have that is swelling a little bit more, you'd want to keep it up. So you see how I have my knee elevated here. It should be actually a little bit higher than this. If I had a second pillow, I would have it a little bit higher so that blood flow can then come back up and reduce the swelling in this area. Gravity will take it back up to the heart. So ideally, I would actually have my leg elevated a little bit more here, but seeing that I only have one pillow, I can only get so high. So we're gonna go just about here usually. Now you might say, well, I have swelling in both knees. So you can take your time with this. You know, do one joint at a time. You don't wanna encourage too much at once. You know, work with one joint at a time, see what works best for you. You know, I like to work in the rest, icing, compression, elevation. You can do this all at once, right? So you can see that I'm resting on my back there. I'm elevating my foot, and I could be compressing it as well with the sleeve as I have the ice on it too, right? So you can target all four of those at once. And this will help with your recovery, especially if you're dealing with the knee pain and swelling. So this is most beneficial to do at the end of the day after all of your activity. However, if you do wake up with swelling in the knee joint, you can perform this at the beginning of your day. And then as the day goes on and you've undergone more activity and stressful events, then you may want to do it again in the evening. When it comes to icing, certainly I wouldn't recommend keeping the ice on your knee joint for longer than 10 minutes at least. So I wouldn't keep it on there for any longer than 10 minutes. And you can do icing every hour for 10 minutes if you'd like. Some people will wait 3 hours in between icing. Like I said, morning you could do it, mid-afternoon you could do it, but again, most important in the morning, and probably secondarily most important in the evenings after all of your activities throughout the day. I hope this is helpful. The R.I.C.E acronym: rest, ice, compression, and elevate for knee swelling and pain. Hope this is helpful.